East Coast Breakfast.
Dr. Sandile Tshabalala, sawubona, Dokotela.
Good morning. Happy Father's Day, happy Youth Month, happy Youth Day. I know you're one of the best fathers that exist.
Thank you.
Happy Father's Day.
Yeah.
There's a survey that says the preferred drink for South African men, the favorite drink of South African men is rooibos tea over everything else.
Preferred by who?
This doesn't sound like a bona fide survey.
It doesn't seem like, unless it's a preference of the ladies for the men, not by the men.
I like that, Doc. I like the way the doctor thinks.
That's more like it.
So, Doc, there's been a lot of alarm about the mpox outbreak. Can you give us a bit of an update on cases in KZN?
In KZN, up to yesterday, we have 7 cases. 2 of the cases have passed on, and all of them are male. The challenge we are having is that we do not know their travel history, and we're worried about that. So we are saying to people they shouldn't panic, but we are trying to check all the conduct so that we trace them and make sure that not many people get to be infected. So far, that's where we are.
Doc, I know at this stage it seems like very small numbers of cases, but do we know the transmission rate of this disease, and obviously then how people can avoid it?
We can safely say it is very low, given the fact that all the 7 that we found, even though the contacts that we have traced and we were able to monitor, none has shown symptoms after 3 weeks of monitoring. So the transmission rate is very, very low. That is why we are now concerned about the travel history of all these clients, so that we then trace it from that level and find exactly where do they get this infection and treat it at that level.
Speaking of a response plan, can you just share with us your interventions that the department's put in place or will introduce so that we can curb the spread?
Already we have introduced this that says when people find the symptoms, they must quarantine or isolate themselves. But also we are ready to do the same for those people that come to us and we see that there are symptoms that need a person to be in hospital. Remember, you can have these symptoms and feel more like you are lively, but when you're sickly, we are able to isolate to give you treatment. The department is also applying for the Section 21 drug that can be made readily available for those that would deserve to be treated with that drug. So far as the department, we are ready. We also are speaking now to the private sector and the GPs for them to be able to treat these clients when they come.
Weekdays from 6 a.m. on East Coast Radio.